So today we are just going to see aquarium fish disease. So usually aquarium is a small closed environment where fishes are confined. The quality of the water medium in the aquarium is constantly changed by various intrinsic and extrinsic matters. Incidence of disease is an outcome of deteriorated water quality prevailing in the aquarium. Feeding aquarium fishes leads to growth of fishes. At the same time, if the feed is not consumed by the fish, it will spoil the ration of pathogenic microbes. And the factors which are involved in causing the disease are abnormal level of dissolved gases, especially oxygen, nitrogen, hydrogen sulfide, methane, etc. Increased level of metabolites, waste products, ammonia, nitrate, and nitrite. Changes in water quality parameters such as pH, hardness, conductivity, temperature, and suspended solids. Toxins, especially chlorine, heavy metal, pesticide, herbicide, etc. And the other factors, sunburn, trauma, predations can also induce. And the aquarium plants are also playing an important role in controlling the health of the fish and aquarium equipment maintenance. And when we're just talking about the disease, and there are different type of disease based upon the causative agents: parasite, bacterial disease, viral disease, protozoal disease, fungal disease, and the disease can also caused by the deficiency. So today we are just going to see about bacterial disease, and first one is columnaris, next red pest, dropsy, scale protrusion, and tail rot. Fin. So the columnaris, so the columnaris is nothing but it's also called as cotton wool or cotton mouth. So the disease is caused by Flexibacter columnaris, and it is a common bacterial disease caused by gram-negative rod bacteria, which is common in cultured fish, particularly live-bearing fish and catfish. Its name is derived from columnar-shaped bacteria, which is present in all aquarium environment. And the bacteria are most likely to infect fish in stress due to poor water quality, inadequate diet, or handling shipping. So columnaries can enter the fish gill, mouth, or via small wounds on the skin. See, highly contagious and may spread the contamination through the net, specimen, container, etc. Columnaries can be external or internal and may follow a chronic or acute course. Lesions in chronic cases progress slowly, and which can also, when they leads to many days, the fish can die. In acute cases, the lesions spread quickly, often wiping out entire population of fish within an hour. The high water temperature accelerates the progression of the disease, and the low temperature does not alter. So the symptom is white spot on mouth, edges of the scales and fins, cottony growth that eats away the mouth, fins disintegrate beginning at the edges, saddleback lesions near the dorsal fin. Fungus can also invade through the affected skin. Rapid gilling in case where the gills are infected. Infections are external and present first as white or gray white spot on the head and around the fins or hills. Lesions may first paler regions that lacks a normal shiny appearance. Later it can develop into an yellowish or brownish. On mouth, the moldy or cottony, the mouth will become eaten away. So fins get eroded and they are frayed in appearance. Gill filaments disintegrate, so there is a problem in the breathing. Ultimately, it leads into the death of the fishes. So less internal symptoms are observed. So this is the case you can see. And the treatment is frequently have to change the water, vacuum gravel. You have to vacuum the gravel because some bacteria can also deposit over here. Add some aquarium salts. Treat with copper sulfate or antibiotic. Discontinue the carbon filtrations during treatment. An external infection should be treated with antibiotic. Copper sulfate, acriflavin, furan, tetramycin can also be given as an oral treatment. So prevention is quarantine the new fishes for 2 weeks, maintain high quality water, balanced diet, unstressed condition, regular water change and vacuuming of the gravel, disinfect the equipments before use, and aquarium salts can be used. And the next type is dropsy. Infections dropsy, which is also a bacterial disease, which is nothing but accumulation of yellow fluid inside the body cavity, caused by Pseudomonas punctata. Intestinal dropsy, so ulcerations can also occur, scale can also protrude, exothalamic conditions can also occur, that is the eyeballs can also protrude outside, ulcer on the skin and fin, deformation of backbone, and the fish tend to jump outside the water frequently. So the treatment is isolation and destruction of the infected fish, dip them in potassium permanganate, addition of streptomycin or chlomycetin. Fin rot, caused by Aeromonas pseudomonas or Vibrio, most common and most preventable, caused by several types of bacteria and often occurs concurrently with other disease. Symptom includes fin edges turns white, fins are fray, bases of the fins are inflamed, entire fin may rot also. To degeneration of the tissues between individual rays of fins. And the causes is stress, poor water quality, overcrowding in the tank, feeding outdated food, overfeeding, and the treatment includes frequent water exchange and addition of antibiotic, chloramphenicol, oxytetracycline, and tetracycline. Removal of food debris, addition of aquarium salt, and the prevention is maintain good water quality, keep proper water parameters, avoid water. So next one is hemorrhagic septicemia, that is red pest. So hemorrhagic septicemia, also called red pest, due to the distinct red streaks that appears on the fish. If the bacteria enters the fish circulatory system, it will travel throughout, causing the damage of blood tissues, blood vessels, and heart. Red pest disease causes red streaks to appear on the fin's body and tail of the fish. So it is given in the Aquarium Life website. Due to the internal nature of the red pest disease, it is often a very difficult disease to treat in an aquarium. So typically, the fish with other health problems are also most susceptible to develop the red pest stress. So it does not respond to any external treatment. The treatment is just making the environmental clean and adding some antibiotics directly to the water. So scale protrusion. So symptom is protruding scales without body bloat. Scales protrusion is essentially a bacterial infections on the scales, both on the scales and body also. Effective treatment is said to add an antibiotic to the food. With the flake food, you can add 1% of the antibiotics. And antibiotics can also be given as a capsule. There is 250 milligrams available. We can add them as 25 grams to flake food. A good antibiotics is chloromycetin or chloramphenicol, or you can also use tetracycline. So if the fish you feed with a frozen food or chopped food, try to use the same ratio